that myth.
Yeah.
That if you go to therapy, then you're a weak man, because naturally, and society expects a man to figure out his own stuff. So it's not a weakness.
Hi guys, welcome back to the Barista Banter. Thank you for joining us again for yet another video, and thank you so much for the engagement in the previous one. If you have not watched it yet, we'll link it to the whatever that we link it to. But thank you for joining us, and thank you for engaging, thank you for commenting, thank you for sharing. It was nice to engage with you. As I said earlier, we are trying to create a community where we are here for each other, me for you, you for me, and we for each other. So thank you again for joining us. Today we are having a very exciting episode. If you don't know, May is Mental Health Awareness Month, and as in the same spirit of the Mental Health Awareness Month, we have a therapist and a life coach. She's called Tracy. Her second name is a bit hard to pronounce.
Thank you, Doreen.
Yes.
It's a pleasure to be here to discuss all things mental health.
Yeah.
And I'm glad to be here. Yeah.
Okay.
So my name's Tracy Corugendo. That's the second name that she talked about. That's very complicated, and I agree with her. It's long and it's different. I'm Tracy Corugendo. I am a psychologist, or call me a therapist, and a life coach. I am very passionate about mental health.
So I think that sets a basis for us to start our conversation today. As I said in the introduction, we are unmasking therapy and myths and misconceptions around therapy, and also life coaching. Of course, maybe you can start off by telling us what's the difference between therapy and a life. What's the difference between being a therapist and a life coach? When should you see a therapist? When should you see a life coach?
Okay, well, therapy is more of a, let's explore what happened, why are you behaving the way that you are, what happened to you. And then life coaching is more of, this is what I want to achieve, this is where I want to be, how do I get there, how do I define it to make it very clear for me. So that's the difference. So some people do therapy and then after they do life coaching, because therapy is more, let's heal.
Yeah.
So after you've healed, then what?
Yeah.
So you're a better version of yourself mentally.
Yeah.
And now you have a clear focus. You have goals, you have visions. So how do you then achieve these visions and goals? That's when life coaching comes in.
Okay.
So life coaching will help you define your goals, your vision, your purpose, look at what patterns that you could be having. So it touches into therapy a little bit, but it focuses on more on where am I going, how do I get there, and therapy focuses on why am I like this, what happened to me. So that's the difference.
Okay. Makes sense. So you can maybe start with therapy, and then after maybe you've addressed what you went through, then go ahead and do life coaching. Is it life coaching?
Yeah, life
coaching. So is that what I understand from it?
Yeah, but therapy is not necessarily what happened to you. It can also be a present situation.
Okay.
And it can be, we have something we call solution focused therapy, where you come with a present issue, and it doesn't have to get you back to what happened to you, because sometimes you've actually done therapy before, addressed what happened to you, then you get another crisis. For example, like trauma. Something could happen, or you lose someone, and it's affecting you mentally and emotionally. So that's what we focus on. So therapy is not necessarily what happened to you. It's not always what happened to you.
It seems you're already debunking myths, because already there's some myths maybe I'm saying, and then you're like, okay, that's not what therapy is. And I love that. So maybe we can start with, so what I did is, while we were anticipating to have this session, I went to my Instagram page and asked people to come up with maybe tell me myths and misconceptions and what we need to debunk, what we need to demystify, and we came up with a list. And maybe we can go through that as we start. And one of the things that people talked about is therapy being for severe mental illnesses or conditions, such that if you maybe are diagnosed with, let's say, bipolar, schizophrenia, or ADHD, or any other of those conditions, then you go see a therapist. And then so maybe you can answer the question around, is therapy only meant for people with mental conditions, or can anyone start and do therapy?
Okay, so people with severe mental health conditions like schizophrenia, psychotism, those are people that sometimes therapy might not really work for them because they are not in touch with reality.
Yeah.
So they see psychiatrists who then put them on medication to be able to function.
Mm-hmm.
But then there are certain mental health conditions like now depression or bipolar where you do the medication but alongside therapy so that you do not become dependent on the medication.
Yeah.
So you do it for a certain period of time and then you still are able to do therapy and do some cognitive restructuring or be able to adapt some coping skills.
Yeah.
So I think why people feel like therapies for severe mentally sick people, it's because of the facilities that we have.
Yeah.
The facilities we have do admission, they take care of the people like Madare here in Kenya and Butapika in Uganda.
Yeah.
I come from Uganda, so I am privileged to be serving as a mental health expert in both countries. So these are facilities that people associate mental health with.
Yeah.
So they think that if you're going to see a therapist, then you're a person that is fit to go to Madare.
Okay.
So that creates the stigma.
Yeah.
If we had big facilities that just do psychotherapists just talk therapy, like you go see a therapist and you talk about your challenges, you find ways to cope. If there were more big facilities like that, like the way we have Chiromo, I know they do some therapy there, but just I'm thinking a particular, like let's say block or building or hospital, and there people just go for talk therapy. There are offices and they do exist, but now these are individual private practices. The organizations are there, but it's individual, so they are scattered. It's not like how we have Chiromo, where it's a hospital and focuses only on talk therapy. That way, I believe, that's my personal opinion, it would reduce on the stigma and the view that therapy is for severely mentally sick people.
Yeah.
And then another thing is it's just a stigma, and especially here in Africa, when we don't understand certain things, behaviors or things that are happening to us mentally, we tend to think that someone is off. And to brand or label someone as someone who is off, that's already creating a stigma and making someone feel like mentally I am unstable. But these issues, we have to remember that these issues, some of the issues are caused, some of them are chemical imbalances in the brain, but there are those that are triggers, and there are those that were caused from the experiences and the environment we went through.
Okay. And I think you touched on something that I'd like for you to clarify to us. Do we refer to this bipolar, schizophrenia, and all those conditions? Are they conditions? Are they sicknesses? What are they?
They are mental disorders. They're mental disorders, but it depends. We wouldn't want to refer them as a sickness. I don't say my client is sick, suffering from bipolar. I would say my client has a mental condition called bipolar, or my client is like a mental condition because they affect your mentality. So I wouldn't want to call them sickness, because a sickness sounds more like you're bedridden. Like you can't do anything, and yet you can have that like bipolar and still be able to function. So you're not sick, you just have a condition that makes you different, that makes life a bit of a struggle for you, but not a sickness.
So, okay, I get it, and I think it's better to also make it less of a burden to someone who has the condition, because you might see yourself as someone who is suffering or has a sickness or is very like derailed, or like all those things from other people. I think it also cushions the person who is suffering from, like, has the condition, I mean. So do you think that everyone should go for therapy?
Okay, not just because I'm a therapist, but yes, everyone needs therapy at one point or another. Here's the reason why. Most of our upbringing, our parents were not intentionally raising us. They were doing the best that they can. And when we keep bringing up upbringing, it's not to label our parents as bad parents. It's to acknowledge that some things were amiss. So then when we get older, we start relating with people.
Yeah.
So we come from different backgrounds. So there are things, that's why I did the unseen struggles. There are things that no one will teach you. You have to figure out in life. And that's why you find that relationships become very difficult because we do not know what to do, and we are clashing a lot because no one taught us.
Yeah.
And then it becomes very difficult to keep relationships.
Yeah.
And then even as you get older, you start to have certain habits that are not fit to have in certain places. Let me say workplace. You could be a toxic boss, you become a toxic leader, and you start bleeding on other people. So I think that's why I advocate for self-awareness. When you are self-aware, you are aware of your flaws and your strength. And then if there are flaws that can be fixed, you then work on them. So who benefits? You benefit, the people around you benefit, your family benefits, and everyone benefits, but the overall person that benefits the most is you, because then you live your life clear and no one is going to come and tell you this is who you are, because you already know who you are.
Yeah. It's like I look at it as working with a burden, yet you don't even know you have a burden.
Exactly.
That's the worst thing you can ever do to yourself.
Yeah.
So also I think I'm not an expert, but I also am of the opinion that everyone should go for therapy.
Yeah. Then to add on that, sorry, Doreen, is just generally life is never perfect or smooth.
Yeah.
Life, you go through ups and downs. Even if you decide that this is where I'm going to live and I'm not going to interact with people, so you'll be affected by the people you interact with, and they will have an impact on you.
Yeah.
You'll be affected by your workplace, leave alone the upbringing. Let's talk about other factors that could affect you, that and the reason why we all require therapy. So the relationships, the workplace, the upbringing and family dynamics, and so many other things that just affect the well-being of someone. And then there are also people who struggle in life because of a mental health condition they are not aware of. Yeah, like let me just give one example, allow me.
Yeah, it's okay.
Like for example, people who have ADHD. People who have ADHD might struggle in academic performance.
Okay.
Yeah, because there are two types of ADHD. The ADHD is attention deficiency. So the people who don't have the ability to pay attention, they don't grasp concepts, they struggle to just focus, and they are careless. We call them careless and clumsy. So sometimes you find that someone is struggling from this this ADHD that is not so hyper. There's the one that you can obviously see someone is so hyper, they climb on stuff, they scream. There's the one that you can see that someone has a condition, but then there's the silent one. So when this person goes to school, they have challenges, they're not performing, guess what the parent will do? They'll just keep pushing and punishing. Yeah. So there are those conditions that people live with and they're not aware. So if you do go to therapy, then you're able to realize that actually this is a cause. So can you imagine for someone who has that ADHD discovering that this is my challenge, and then you put the focus on their strength. If it's not academic, everyone is gifted. What can they focus on?
So I'm also thinking in the lines of, can the focus be shifted to things that maybe they are best? I think that's what you're saying. The focus can be shifted to things that they are very good at, instead of like pushing them to be a certain person that they're not. Okay. So maybe you can go to the next point. And the next point, maybe a myth, or is it, we don't know that it's a myth or it's a fact, maybe you can tell us. Does seeking help mean that you are weak and you are not able to solve your own problems, that you need help in solving your own problems?
Well, it's a myth.
It's
a myth that people think that going to therapy is for weak people, and that's why I don't have a gender bias. That's why men struggle to go. Majority of men are not open to doing therapy because they were brought up and raised with a toxic masculinity where they're told a man needs to be strong. A man cannot be weak. So for men, I've also interacted with some men that feel like, no, I can't sort this by myself. So for men, it becomes very difficult for them to seek therapy because of that myth. That if you go to therapy, then you're a weak man, because naturally, and society expects a man to figure out his own stuff. So it's not a weakness. Actually, I tend to commend the people who go to therapy because that takes strength and courage. So you, despite the myth, you go above and beyond, and you're willing to be vulnerable and discover who you are. So you tell me, between a person who's self-aware and a person who's not self-aware, who has more power?
Of course, the person who is self-aware.
Exactly.
Yeah. So it means that you acknowledge that you have maybe a problem, and then you seek to address the problem. So there's also another myth that therapy is expensive and inaccessible. So is it true that therapy is expensive and inaccessible?
I think expensive is relative, and there are also ways where the it can be a bit in terms of cost. There's insurance for some people, and then there are also facilities like, I think Kenyatta, the prices are a bit lower. But also, I think I would like to, just like you go to a hospital and pay to see a doctor, the doctor is doing his job. So even as therapists, we go to school, we invest a lot of time, and this becomes our job. And we have families, and we have to take care of our families. So for us to charge for this service is so that we can also be able to take care of our responsibilities and obligations. So I feel like there are so many other services that people are willing to pay for, but when it comes to therapy, there's this, it's expensive.
I had you touch on someone thinking of therapy as something they would maybe, like the same way they'd go to a doctor, the same way maybe they'd take time and their resources to go to a therapist. Then that debunks the myth of it being inaccessible or expensive, because again, I also remember, maybe you can tell us, there's a time I used to go to Kenyatta. There's a youth clinic where they offer actually free therapy. I'm not sure whether it still exists, but I'm sure there are resources for everyone, and like availability of resources for everyone to access therapy if they want to.
They're there, like Kenyatta, like I said. And then I'm not very sure about the others. The one I know for now is Kenyatta. But I think even when you check online free therapy services in Kenya, there are some that are available.
Okay. So maybe you can go to our next point, which someone said that therapists only listen and don't give advice. We had talked about advice, which maybe you can touch on slightly in a different light. And someone also said a therapist just sits there and says, how does that make you feel? So, how is that?
Yeah, that's interesting, because people think our job is easy. If it was that easy, then people would not struggle mentally. I mean, you can just go to anyone, share your issues, and like I said, and then, so what most people do when you share your issue with someone, they advise you. And if advice really worked, then people would solve their problems.
True.
But you see, with therapy, we are able to pick where the issue is coming from. Your friend will not be able to ask you about your childhood. And if you go to your friend with a marital issue, they'll not even ask the part you played. They have to be your friend. So theirs is to support you. But minus all of that, we don't sit there and ask, how do you feel? We are listening. We are taking on the burden of your issues. We are trying to explore as you speak. We are trying to empathize with you. We are trying not to be biased. We are trying to see, we do really, like I personally, let me speak for myself. When a client comes to me and they have an issue, I just want them to leave feeling much better. And that's a lot of work. A lot of work comes from the client, but it's also my job to try and push the client a little bit to do the work. And it's not that easy, especially if it's adult clients, because these are people who feel like they know it all. You might say certain things that they don't agree. So our job is not easy. Sitting there and listening to some of the stories are very traumatizing. And then at the end of the day, we sit there, listen to the story. Even on TV, when they show graphic images, they always give a warning. So for us, we have to listen to the narration of it all. And then the expectation is you're supposed to listen and then detach and move on with life. it's very difficult.
So is it more of guiding someone through their conversation, or is it more of, you mentioned something about solution-based earlier, so is it a solution-based therapy, or is it someone finding a solution for themselves as you guide them through therapy?
So it's a personal discovery. Most of these issues, we bury them in the unconsciousness.
Yeah.
So we do not know that they affect us. So when you come to therapy, we first dig and dig and dig and then bring things back to the conscious mind.
Yeah.
And then now we're able to see how these things affect you. So first we start discovering. So I'm like this and this because this happened. So now that this is affecting me, how do I move forward? Then we start the healing journey.
Yeah.
So the therapist equips you with the skills, brings the unconscious to the conscious, which creates the awareness that we're talking about. Yeah. And then that way, after you've done the self-awareness and the discovery and knowing what things are affecting who you are, then they support you on how to be able to move forward. And some people do therapy for such a long time. It depends. Yeah. So there are people who decide to continue working with a therapist for a long time until they feel like they are on their feet. So mine is to carry your story, see and also correct because some of the things are cognitive distortions. So there are things that you've labeled yourself or you've sabotaged yourself that I undo, that you don't even know that you're self-sabotaging. Yeah. So someone could easily use a certain word in the way they describe themselves. You know me, I cannot do this. I always struggle with this. I unconsciously they don't notice that they're self-sabotaging. That's part of my job, to bring this to the awareness. Yeah. So the work is from the client to tell your story, and then I identify the blind spots or the areas that we need to work on. Yeah. And then I identify the ones that you just need to simply change the way you're stating or saying things about yourself, and then support you, and then now you are a better version of yourself. Okay. So if you could do that on your own, then we would all be better versions of yourself. True. So even me as a therapist, I do therapy. I do supervision. I don't do therapy for myself. I have to go and get support. Yeah. So in short, we all need therapy. Even the therapist needs therapy. Actually, I think you touched on what I wanted to ask, because you mentioned about listening to traumatic experiences. So I wanted to know, like, how do you decompress? How do you now sit down and say, now it's like you're bearing the burden of so many people with traumatic experiences. So is that how you decompress? So we do supervision depending if you have a very heavy issue and it has affected you, then we do supervision. But for some of the issues in our training, we are able to have empathy, where I put myself in the client's world and then remove myself. Yeah. So like personally, before I did my training, all I had was sympathy. Sympathy, you stay in the client's world, you stay in someone's world. Someone tells you something, it affects you, you can't sleep, you're thinking about it, you're trying to find a solution, you're so engraved in it. But our training teaches us to have more of empathy, where you feel for someone, but then you know that's their world. So that is a skill that helps us to be able to remove ourselves and know that that's the client's world. I'm only here to support. So I do supervision, and then I focus more on having empathy rather than sympathy. Yeah. Yeah. So you also talked about cognitive distortions, something I wanted to get into quite a bit. We hear people saying, even Donakwanga, I'm always like this. So is it that people mask these mental health conditions as ways to escape from accountability? Because I had someone mention that sometime when you're having a conversation. Or is it that they are not aware that they are masking and evading accountability by saying, nakuanga hivi? Yeah, so that's a defense mechanism. Yeah. When someone says, this is who I am. And especially if it's coming from multiple people. I always say, that's my personal opinion, if you really want to know that you have a challenge, especially in areas of growth or areas of weakness, you choose a group of friends and ask them to give you feedback about yourself, and we embrace it. Yeah. So if 1 or 2, 3, 4 people say the same thing, then there's a problem.
Yeah.
But if they say it and you're like, you guys, I'm like this, that's just creating excuses.
Yeah.
And those are there's so many defense mechanisms that we have to protect ourselves.
Yeah.
So that we don't feel vulnerable. So for someone to say, I'm always like this, it's just denial. Denying that you actually are a certain type of way that needs to change.
Yeah.
So you're not at a place where you're willing to accept that this could be a flaw that you need to work on, that it's affecting so many other people. And that's why now when someone has that kind of mentality, then it's so hard for them to grow. So that's what we call the fixed mindset.
Yeah.
Yeah.
Yeah. Sorry, I may take you back quite a bit because sometimes I'm remembering things that you said and then I want to touch on them. So you talked about the whole process of like therapy, not really in detail, but you touched on it a bit. So we see a rise in the use of AI, like ChatGPT, to replace therapy. Or like we see people who say, I can talk to ChatGPT will give me answers. So again, what's the line? Again, I'm using this statement a lot. What's the line between AI and ChatGPT or whatever AI that people use and going for therapy with a person? And as answer that alongside, people are very biased towards virtual therapy sessions and they think that it's better to have physical therapy sessions. So maybe you can answer those two together.
Okay, thank you for bringing up AI because it's something that I've been reading about. It's something that I've seen. People go to ChatGPT, you type your symptoms and then it's able to give you a few things and how you can cope.
Yeah.
And that's amazing. The world is evolving. We can't do away with technology. But however, ChatGPT will not give you emotional and empathy that human touch gives you. ChatGPT might not necessarily try to dig deeper because I'll go to ChatGPT and I'm like, I'm short-tempered, I have an issue talking to certain types of people, what could be my issue? Then it will diagnose you.
Yeah.
But then for me, I'll be able to ask, when did it start?
Yeah.
What happened? You tell me at 9 years. So at 9 years, what happened?
Yeah.
ChatGPT will not do that for you. It will not walk a journey for you. It will just give you a summary depending on what you have fed it.
Yeah.
But as a therapist one-on-one, ChatGPT does not see the non-verbals.
Yeah.
Like we were shooting and I felt like your eye got teary. ChatGPT will not see that.
Yeah.
Because in the interaction human to human, I'll ask you something, you either bite your lips or you hesitate. I'll pick that as a discomfort.
True.
And if you're not willing to talk about it, I'll pick it up another time.
Yeah.
Would you get that from AI?
Of course not.
So there's so much that, yes, AI is here, it can help here and there, maybe give you a diagnosis, create awareness that you actually have maybe an issue to address. That's the part and the role I believe it can play. And not just because I'm a psychologist, but I think one-on-one and just being able to sit down and talk to someone really, really is very therapeutic in itself. And it's something that AI might never give you.
Also, as a person who has embraced therapy and seeing a therapist, I think it's way different when you consult AI and when you go to a therapist. I think it's different. So maybe now, again, virtual therapy and physical therapy. So, of course, you're talking about gestures and all like the emotional touch with a therapist. So does that go away with a virtual therapy session? Are the rates the same for virtual therapy session and physical therapy session?
Well, I think, like I say, change is here, technology is here to stay. I think now virtual and physical will just be a personal preference. But for me as a therapist, I am able to pick on the non-verbals even virtually because it's like a live video. I can see you, we are speaking, I'm still interacting, I'm still asking. If it was physical touch involved, then that would be, but still virtually we can be able to pick the non-verbals, we can still be able to show empathy, we can still be able to do all the physical, all the things that physical can do. But there are people who just prefer to go somewhere, sit with someone and do the session because maybe the homes where they are the ones that are bringing them a lot of chronic stress. So going out in itself is therapeutical, to be able to go sit somewhere and create a new memory where you go and share your challenges.
Yeah, okay. Maybe this goes a bit off what we are discussing, but I'm just curious. Are there instances where maybe you have developed friendships with clients and maybe you have had to cut them short, or how do you deal with that, or are there any instances like that?
I have not had any because most of my clients are people that reach out and I ask what their expectations are, and we set a number of sessions. So I don't get to interact with them in a social setup. So I am able to see them maybe once a week or once every 2 weeks, depending on the schedule. And when we meet, we are only talking about therapy. So we're only talking about the issues that we're working a journey. Let's say if it's 10 sessions, it's once a week, and when we finish the sessions, then we go. If a client wants to ask something personal, I can answer, or I can. So I have not had, I think professionally, because I'm grounded by the ethics, I don't let it get to that. I was thinking of also a situation where, I don't know, I think that line of thought has escaped. Maybe when I get it, I'll ask you. But maybe you can go to the next myth to debunk. The line between therapy and spirituality. Are you as a therapist allowed to include spiritual beliefs and spiritual inclinations? And do you, like, somebody mentioned, we had a conversation when I asked like this question on my Instagram account, and someone was talking about spiritual healing and emotional healing, and they are two different things. So do you go to a therapist for spiritual healing as well, or are there therapists that are also allowed to include spiritual? Like if I come to you, maybe for instance, I ask you, are you a Christian? Maybe I'm a Christian and I'd like to have a Christian touch to my therapy session. So how does that go, and how does that look like, or does such a thing exist? Okay, so spirituality is a personal belief in a higher being. So in therapy, we don't. Let me focus on I. I personally do not bring in my spiritual beliefs. I do not impose my values on my client. So spirituality, unless the client brings it in the session and they would like to talk about it, then we can talk about it. But it's not going to be my go-to approach in supporting my client. I will embrace it, talk about it, whichever direction the client wants, and then after that I go back to the skills. So they are two different. And I know that for most therapists, our approach is psychological, and we use skills. But for spirituality, it's more of a personal journey and a belief where you're walking your own personal journey, and having your own maybe challenges when it comes to that. I feel that you can also sometimes be able to heal by yourself. So the two are different, but mostly what I would like to comment on is even if I'm a Christian, yes I am, I will not sell myself as a Christian-based therapist. So I am for all.
Sorry, may I interrupt? So are there people who sell themselves as like a faith-based therapy? Like,
I'm not sure about that, so I'll not comment on it. But I know that there are people who prefer to go to church to seek counseling. There are people who prefer to go to church. So I don't know if when they go to church, they are looking for more of a spiritual kind of healing. But I'm just saying that I am open to all, because if I get a client who is of a different spiritual background than me, if I was using my spiritual background to support my clients, then it creates a bias. So that's why I do not bring in my spirituality when it comes to my job.
You mentioned counseling. So counseling and therapy, are they the same?
Not so different, but therapy will go deeper and support you and enable you, and you narrate your story. And counseling sometimes can be just telling you, try this, do this, more of like showing you a sense of direction. But you can also be a counseling psychologist. So where you do the counseling and then are also able to do the background work on what is happening to someone. looking at their behavior and thought pattern.
Yeah. So what is counseling? What is counseling?
Counseling is more like, so I come to you and I want a counseling. I think the titles are similar.
Mm-hmm.
The titles are similar. It depends on what title you want to call yourself. So I can be a counselor.
Yeah.
I can be a psychologist.
Yeah.
I can be a therapist.
Yeah.
I know the difference comes into when it comes to psychiatrists, the ones that give medication. But a counselor can also be a therapist or a psychologist, depending on their qualifications.
Yeah.
But I think it depends on a person's qualifications, because I also know that churches have counselors that might not necessarily be psychiatrists or psychologists. So I think it's more of a title thing.
Yeah.
Yeah.
I think we'll get to that because we also have another segment where we talk about therapy, how to approach therapy, where do I start? I think we'll get to that. And maybe our last thing on myths and misconceptions that I'd like for you to maybe give us a factual rebuttal is on couples therapy. So I had someone talk about how they think, or maybe it's a myth, that when you go for a couples therapy, the therapist is inclined to one person, like a person that maybe they take liking to, or they think is suffering in the relationship. So how is that? How does couples therapy look like, and how, like, is there an inclination to one side? How do you stop yourself from being inclined to one side that you maybe think is a person, maybe you think is suffering in the relationship, they don't even know? So how is that?
Okay. First of all, I think what I would like to acknowledge is that we are human beings, and sometimes as human beings we have a bias. But when you sign up to be a psychologist or a counselor or a therapist, we go through training. We don't just go to school and then we become therapists. So some of those like biases I talked about, biases, imposing values, having sympathy, we are trained on how to manage those and not bring them to our therapy rooms.
Okay.
So the same thing goes for couples.
Yeah.
When you do get a couple, the right thing is to hear both of them out. And a lot of times, or majority of the times, couples are separated. And when you separate couples, you do individual counseling and then bring them back together. That means by the separation helps to ground both of them. And when they come together, it's not an attack, it's not on who's right. Remember, in therapy, the clients do most of the work.
Yeah.
Mine is to support and identify the blind spots and identify the areas that need to be addressed. But depending on someone's experience, I've also had couples that say they went to therapy and felt like the therapist was biased and they picked one side. And I think that's as a result of not being able to separate them.
Yeah.
So that I think by separation, I have done a couple, and by separation you're able to show them that the goal is for the goal is for both of them to win.
Yeah.
And that whatever they'll achieve from this is for both of them, not for this person to win and the other person to win. So I think it's the training and being professional, and it really helps when you separate couples, from my personal experience.
Okay.
Yeah.
And you've taken a tangent where you are discussing a situation where the relationship is broken, but do we also see a situation where there's a healthy couple that wants to maybe go and, okay, we know of course an individual wanting to be self-aware and all these things. So do you have a situation where a couple can come and say, we are doing well, we are okay, but we'd like to explore therapy? Yeah.
Yes. Like for example, premarital counseling, it happens at a stage when people are in like honeymoon stage. The love is booming, they're so happy they can't wait to get married. Yeah. So there's that type of counseling where you keep equipping them with skills on how to navigate marriage. There's also the couple that comes and they want to, like now that happy couple, they're doing well and they just want to grow. Yeah. And depending on the areas, it has to come from them. So what brings them to therapy? What is that area they would want to do better at, or to what area do they think they want to grow at? Because the fact that they've considered therapy, then there's something they want to address. So we usually get the course of direction from the client.
Okay. Yeah. Okay. So I think my train of thought that I lost a couple of minutes back is now back. Okay. again, I think this is something I asked a bit, but I think I want us to delve in it a bit more. Is therapy directive? Like, can I come to a therapist wanting them to tell me what to do? And can I come to a therapist wanting them to help me analyze or pick things from what I'm telling them of my situation? Or, I don't know that the question is clear.
Yes, it is. Unfortunately, therapy is not directive. That would be unprofessional, because that is me imposing on the client, and it would sound more like advice if it was directive, because it would sound like, I need you to go do A, B, C, D, and D.
Yeah.
And it might not necessarily work in the client's world, because people are in different situations.
Yeah.
So we support our clients by identifying things that they might not necessarily see. I think I talked about cognitive distortions, like self-sabotage. So a client could come to me and they are sabotaging themselves unknowingly, or they are victims, or they are in the fixed mindset. So as they narrate their story, I'm able now to point out that what they are doing to sabotage themselves. Then I bring it to their conscious mind. And then we address it. So I can give skills that you go and try out, but even for those skills or those tips that I give, I get to learn my client's world. What's within their reach, what's within their means, what can they work with. Then I give them tips on depending on their situation or their world. So it's not directive. All we do is support, encourage, and help them to look at their own lives, at their own issues from a different perspective. So it's more of learning, unlearning, and relearning.